Okay, first of all, I have a question. How many of you in your club have President's Projects? Okay, our club. So I thought every club had a President's Project until fairly recently. And what it is I was last year's president for our club. And every incoming president has the opportunity to have a President's Project. So what that is it is a longtime tradition of our club spanning decades. And the benefit of the project is an added layer of service opportunities for our membership and an additional topic focus of programs throughout the years. There have been a great variety of examples of President's Projects, and here's a few of them. Sex trafficking, women's health, Alzheimer's disease, leadership for high school girls, erasing the stigma of mental health, and most recently, my President's Project, cervical cancer. And what it does is it allows the president to really bring something to the club that means so much to them. In September, we had a retreat. It was a 2-day retreat, the first one in many years. We had them consistently, but I wanted to go away and I wanted us to really bond in this retreat. So we went 2 days to Mount Shasta, and I had presented this President's Project to the club. And the amount of positive response I got was incredible. 2 of the women of our club came up to me personally and said, I had cervical cancer when I was younger. My niece had cervical cancer. So just from that, it really started to take off within our club. I really had no idea, none of us did, how much this project would take off. But my inspiration, and this is where I always get choked up, my inspiration for this President Project was Mandy Johnson Pearson. She was my friend. She was my general manager of my company for 7 years. She was fun, happy. She was a renowned cheesemaker, newly married, and died at age 34 of cervical cancer. Mandy and her husband, John, decided to do a photo shoot right before she started cervical cancer. This was Mandy, okay? She did one right before she died. She did not look like this. So this was my motivation, but I also, in previous years, I'm in the coffee industry, hence the Sean Connery thing, and cervical cancer is rampant in Africa, which we're going to talk about, and Latin America. And Coffee Growing Region has an organization called Grounds for Health. So even before we started this project, I was involved with Grounds for Health in coffee growing regions. So that's how the project started. Now Nikki is going to give you some facts about cervical cancer.
And excuse me, these facts are fairly dry, but they're really important. There's 13,380 new cases of invasive cervical cancer that'll be diagnosed this year in the United States. And about 4,360 women will die.
Yeah.
It's easy for these numbers to be attached. It's easy for these to just be numbers until they're attached to a person. And that's what Mandy did for us. I'll be better. So now the dry facts. Cervical cancer is the fourth most common cancer in women globally. 660,000 new cases will be diagnosed, and 350,000 new deaths took place in 2022. Think of those numbers. That's like half the women diagnosed. Now, they weren't the same women, but that's huge. 90% of all of those women that did die came from low or middle income countries, and the highest mortality rates are from Sub-Saharan Africa, Central America, and Southeast Asia. You can just see a whole swath across there. And of course, it disproportionately affects young women. And as a result, it leaves children. 20% of the children who lose their mother to cancer lose it because of cervical cancer. And in Butte County, our county, it's the highest mortality rate in Northern California, is in Butte County. It's one of the highest in the state. But in Butte County, for every 100,000 women, 3 die of cervical cancer a year. That's a lot. Now, Amy's going to talk about how the idea grew.
So, we created the project in the hopes that it would provide free cervical cancer screening clinics to our community. And our community is quite large. We have Paradise, Chico, Durham, like all these little towns. So Butte County is quite large when you think about it's just not Chico. And then we wanted to find local partners to join us in this effort. We are the third person that we have with us. It was a whole club initiative, but Jackie Travis was a retired public health director of Yuba County. And she said at the very beginning, because I'm like, oh, we could do this and we can do that. And she's like, no, we need to go. There's a roadmap for us with these agencies, public health, and all these agencies that we're going to talk about. Let's just go to them and let's sit down with them. And these agencies were so dang happy that we came to them because they were very well aware of the rise of cervical cancer, but their hands are so tied doing all the many, many things that they do. So they really, specifically a woman by the name of Lisa Almagor with Butte County Health, was just incredible for us. So we didn't recreate the wheel. We met with other organizations that helped us do what we want to do.
And from that, my part was to start educating the community broadly about cervical cancer and the ramifications of not getting treated, not getting tested. That really began with having conversations with people, because Pap tests are not something we sit around and talk about. We don't sit there and ask, when should I have my first Pap test? How often should I have it? When did you have your last one? So these conversations had to start being had. And once we started having them, we started gaining all this information, and the word got out. And then we can talk about the roadmap to making it a successful project.
First thing we did, we knew at that point that the project was going to be quite large. So, not that I am tooting our own horn for our club, but beep beep. We have some amazingly strong, smart women that belong to our club. So I was able to get an incredible ad hoc committee from the very get-go that supported me in what we should do, nurses and retired president of the university, and just things, strong women that knew the public, knew how to traverse through all of this. So that was the first thing that we did, was get a really strong ad hoc committee.
And we continued the education. We continued educating our club members about, again, cervical cancer generally and how it was impacting our own community. And I can tell you that this was surprising when we started doing the research, and shocking to most of the healthcare providers that we talked to. They had no idea that cervical cancer rates were what they were in Butte County. And from that, we got a lot of motivation going. And we were able to connect with different partners. Specifically, Butte County Public Health, there was Lisa Almagor, the outreach person, and I worked hand in hand with the epidemiologist for Butte County. And then there's a group in California, I believe it's in other states too, but I know California, it's Every Woman Counts. And they're funded by California Department of Healthcare Services, and they provide free breast cancer and cervical cancer screening and diagnostic services for California's underserved population. We worked with Ampla Health and Adventist Health to get this partnership that we needed.
You know, I'm a business person, I'm not a healthcare person. Nikki is, and so is Jackie. If we did not have that support of somebody that understood healthcare, it would have been really hard. But Jackie understood the public part of it, and she could talk intelligently with the healthcare providers. That was not my role at all. So now you're probably wondering how we were able to afford this. So are you guys at all familiar, are you women, trying to stop that, are you women at all aware of Power of 100 Women? Okay, you are, cool. I would highly recommend you look into it in your area. So what it is I actually was one of the founding members of it, so I was well aware. So every 3 months, women come together, and they say it's 100, but sometimes it's less, but a lot of times it's more. And they will put $100, we write a check right then and there for $100. And 3 months before, 3 501c organizations will present a 5-minute presentation to win this money, right? So it just so happened that we won that draw 3 months before. So the club decided that the best thing for us to present was cervical cancer. So I am going to read, if you guys want to know more about, Power of 100 Women, catch me, and I'm a huge advocate of the group. I actually do write quite a bit of checks for different organizations, but this one I know exactly where the money goes, and it's only $100 every 3 months, and it's so powerful for the people that get it. Okay, so here was my Power of 100. Okay. Hello, my name is Amy Lewis, and I'm the president of Soroptimist International of Chico. I'm here to talk to you about cervical cancer because we don't talk about it. Think about it. When was the last time you had a conversation with a friend, your daughter or granddaughter about getting a pap smear or even cervical cancer? The mission of Soroptimist is to improve the lives of women and girls. Each year, the incoming president has the opportunity to choose a project that becomes a central focus of our 60-member club. In 2015, my dear friend, community member, and employee Mandy Johnson Pearson died of cervical cancer at the age of 34. She had her whole life in front of her, and to this day, I can't wrap my head around the profound loss of such a young and vibrant woman. Cervical cancer has had a significant impact on the lives of women around the world and in our community, and there is work to be done. With increased awareness, good information, and preventive measures, all of you in this room can literally help save lives. Butte County has one of the highest mortality rates in Northern California. Women in Butte County are dying from cervical cancer at a higher rate than any other county in Northern California. This alarming statistic can be attributed to women putting off screenings, the lack of doctors in our area, financial barriers, and the ongoing impact of the Camp Fire. Early detection through regular screening saves lives. Collectively, we can begin to change the narrative of these deadly statistics. I stand here hopeful. Solution and plan. With the Power of 100 Women funding, we can see more women, screen more women, and help more women. In January, which is Cervical Cancer Awareness Month, our club will work on a multi-pronged approach to make a difference. We are launching a community awareness campaign, partnering with Butte County Public Health, who will develop materials, and we together will spread the word. We share information about cervical cancer and emphasize the importance of early detection and receiving regular pap screenings. Special attention will be given to populations with little or no access to care. The uninsured, underserved will be targeted. This includes the African American community, the Hmong community, and the Latino community. We have been advised that these women have more barriers to testing and higher rates of positive cancer diagnosis. In January, Soroptimist and Chico will be partnering with Ambla Health to sponsor 2 clinics in January. The goal is to see 40 patients per clinic. Any positive pap smear test results will be referred to the appropriate physician within the Ambla Health system. Soroptimist's role in this partnership is to remove some of the barriers to accessing care by sponsoring the clinics on a weekend and after hours, and also providing incentives. In providing a free, safe, incentivized opportunity for screening, women who are reluctant to getting a pap screening or can't take time for personal health will sign up. We estimate the cost per clinic to be $2,000. With funding from the Power of 100 Women, we will be able to support as many as 9 additional clinics, $2,000 per clinic, and see additional 320 women. That would be a grand total of 460 women that would be screened. In conclusion, we believe that educating women empowers women to take charge of their own health, make informed decisions, and advocate for their well-being. I imagine that the women in this room have better access to regular health care. Unfortunately, this is not the case for many women in our community. We here in this room recognize the power of women coming together to make an impact in our community. We have witnessed it. We have the opportunity to change the narrative of our community having the highest mortality rate for cervical cancer. It begins with us. So that was my presentation for cervical cancer. Now I'm going to talk a little bit about funding. We won the Power of 100 Women. And from that, we won $20,000. We also got a matching grant from the Schultz Foundation for $5,000. That's a big supporter of Power of 100 Women. And then to move on to that, we were given 2 more private grants that brought our total for the project to $39,150. Yep.
So with that money, I mean, can you imagine? Of course she got voted yes. Of course she got the money. This allowed us to do free or low cost screenings to women who, it didn't matter what they could pay. We were not paying for the screenings. We were providing the clinics or helping support the clinics. We didn't pay for any of the screenings. Come to find out, they were all free. California will provide a Pap test for almost any woman. We didn't find any that they wouldn't provide for.
So what we mean about what we did with the money was our funding paid for promotional materials. For instance, we did a flyer and our club went and distributed these flyers, and the flyers were done in English, Spanish, and Hmong, because we have a large Hmong community. And then we had educational materials that we put in the bags. We also put Soroptimist material in the bags, snacks at the clinics, and gifts for the women who got screened. Now, I'm going to tell you that when this all started, now I came from a middle class family, single mom, 4 kids, but we had money, and we had health care. So I could not personally understand why we needed to give women incentives to come and take care of themselves. I was so pissed off about it. I'm like, why do we have to give them a $25 gift card to Winco or for gas? Boy, was I wrong. Those women, their first thing were to take care of their kids and take care of their families and put food on their table. And if they knew that they had to leave work, if they had a job, and get in their car and come down from Paradise or whatever they were doing, or had to pay for a babysitter because they didn't want to take their kid to something as personal as a pap smear, the incentive was to give them a grocery card or a gas card. And it worked. But still, there were, the AMBLA said, oh, it's really hard to get people to come, and they cancel. And it was just, we're like, oh, we could do it. We're going to give them all this great stuff. But it was true, and then one day it rained, and, people's car broke down. But I understood why we needed to incentivize, and it wasn't about the candle or about the crap. It really was about those cards that made it so they could come. So now Nikki's kind of going to go over the nuts and bolts of our project.
So when it came time for the clinics, this was the product of all of our work. Beginning in January of 2024, we held 2 clinics a month for 4 months in Chico with Ampla Health, and 2 clinics in April for Adventist Health in Paradise. That's a total of 10 clinics. Now granted, we did not see the 400 women that we thought we were going to see.
We tried.
However, of the 168 women that came in, (16) had abnormal PAPs. That's 10%. So that means that 16 women in Butte County are going to have an opportunity to stop the progression of this disease. That's pretty exciting, isn't it? Now, we know that January is Cervical Cancer Awareness Month. So what we're going to do this January is we're going to continue this project and only do it in January and do it for as long as we have money.
Which will I'll be dead by that time for $39,000.
I don't think so. We're thinking 3 to 5 years, but it certainly could be longer. And she's going to talk about the visibility that this provided for Chico, Soroptimist, and SI Chico.
Yeah. So I want to tell you that, and I said it a little bit in my presentation, it's really not even on the screen, but we don't talk about our bodies, right? We just don't. Men do. See it on TV, and I won't get into what we see, but we see a lot of it. Right?
Thank you.
So one of the things I did as president, I would get up and say the word vagina as much as possible, because you want to take the stigma and the power away from talking about our bodies. Because if women and girls talked about getting a pap, we all talk about mammograms. Oh, I'm going next week to get my mammogram. When was the last time you heard a friend say, I'm going to get a pap smear? You don't. It's like this. We just don't talk about our bodies. So we got to take that away and talk about our bodies and let our daughters and our granddaughters talk about our body, because then it will become the norm to get screenings, right? So this project, the visibility for our club was huge. So first thing was, I went to this thing at the university, and I saw our local newswoman. Her name's Linda Watkins Bennett, and I had met her before, and I sat next to her, and I said, she goes, what do you up to? And I said, oh, I'm doing cervical cancer, it's my project. And she said, oh shoot, that reminds me, I need to get a pap smear. I'm totally behind in my pap smear. So she had me on to her show twice, and we talked about it. But as soon as I walked through the door, she goes, I got my pap smear in front of all her coworkers, right? So I had this great conversation about our project and was able to mention Mandy's name, which is powerful for me. But we were on TV twice, on news twice. We were able to promote not only our clinics, but put our name all over the place. We had, because we won Power of 100 Women, we had 2 big old interviews in the newspaper with Soroptimist International of Chico. I was interviewed on the radio. We were interviewed on the radio. And every time we were able to talk about Soroptimist, we were able to, about cervical cancer, we were able to talk about Soroptimist and what our mission was. The really cool thing is Billy, I can't think it was Billy, I think she applied, I can't remember, and I'm sorry, Billy, if it was you. We applied and got it was Jackie Travis, I think, sorry. We were given the Butte County Board of Supervisors proclamation for declaring January a Cervical Cancer Awareness Month. And so we got a certificate, we went to the Board of Supervisors meeting, it was super powerful. And there were a bunch of anti-vaxxers there to boycott us, but whatever. Yeah, I want to mention that. So at the beginning, we decided, just because of the environment, that we were not going to talk about HPV vaccine. Like, it just wasn't what we wanted to get into and have people boycotting our things. But I will tell you that cervical cancer is one of the only cancers that doesn't have to happen if you have the HPV vaccine. It is one of the only preventative cancers there are. I would not say that at a public venue, but it is true. But she would, but then we'd have to kick her out of the club. No. But yes, but like when we were on TV, we said we don't want to talk about the HPV vaccine. Unfortunately, it's really just crazy that we can't, but we did not want to get into that political environment. Sorry. Okay, now, Nikki is going to talk a little bit about the worldwide problem that we have with cervical cancer.
I would talk about the HPV vaccine.
Yeah.
Because again, it's the only cancer that can be completely not exist with the HPV vaccine. And many of the things that you hear, like, well, it only affects one type of HPV or this and that, it's just not true. Just look into it. That's my spiel, and I'll leave that alone. Now we've seen how cervical cancer, if we've talked about cervical cancer, how it affects Butte County, how it affects California, but this is a worldwide problem, far more than in our corner of the world. It's big for us, but cervical cancer is the 4th most common cancer in women globally, the 4th, with around 660 million women getting it, and again, 350 women dying.
50,000.
350,000 women, I'm a number thing. And in 2022, that's how many died. That's huge. 94% of those deaths, again, occurred in low and middle income areas of the world, countries, with Sub-Saharan Africa, Central America, and Southeast Asia. You're hearing these statistics again for a reason. We've talked about how it affects younger women. So what we know as Soroptimist is that in many parts of the world, and even some parts of the United States, when mothers die, daughters have to quit school to take care of their family, and that ends their education and blunts their ability of what they can do in life. Now you've heard all these statistics, and you've heard them twice now, but keep them in mind as Amy goes on and talks about the next part of our discussion.
So Trudy asked me to speak about the African Federation. I knew a bit, not so much about the Federation, but I knew about the problem in Africa because of coffee. And I had been working with Grounds for Health, so it wasn't a complete surprise to me that Soroptimist was now getting involved. So at the SI conference in Dublin in 2023, the African Federation did a session on cervical cancer elimination campaign. After Africa is the hardest hit continent, with 320 women hearing the words, "You have cervical cancer," every day. 321 women every day. Cervical cancer is the second most common diagnosed cancer and the second leading cause of cancer death in Africa. Cervical cancer, now hear this. Cervical cancer is the #1 cause of death for women in 38 of the 54 African nations. Okay, #1 death. Here's how I know that women are not aware of this, and this is not a slam, because there are not that many women here to hear this. We don't get it. We just don't get it. #1 cause of death in 38 African nations. It's one of these, kind of like how your coffee gets to your cup, out of sight, out of mind. We just don't get it, but it's a problem. So Nikki's going to talk a little bit more about the goals of the African Federation, who have aligned themselves with WHO and Cervical Cancer Elimination Plan, who is World Health Organization.
So after hearing those numbers, you know where that 350,000 women, where they come from. That's shocking to me. So Soroptimist International Africa Federation, let's see if I can say that right, has joined forces with the UN Health for Life Fund and the World Health Organization on a project, an action to eliminate the elimination of cervical cancer across Africa. That is a very bold statement. The African Federation states, these are their words, "Today we have cost-effective means to prevent and treat the disease, sparing women from this invisible killer. The World Health Global Elimination Strategy is achievable and calls on all countries by 2030 to reach." Now I'm going to read these goals. That's a 3-tiered process or goal, 3 tiers that they're working on. These are not the same standards that we have in the United States. So keep that in mind. They're aiming to have 90% of girls fully vaccinated with HPV vaccine by the age of 15. We know that's a little late for that vaccination. In the United States, it starts at 9 years old.
Boys and girls.
Boys and girls at 9 years old. So that's a little late, but they're aiming for goals they can reach. 70% of women screened using a high-performance test by the age of 35, and again by 40. Mandy was dead before then. That's a little old to start. 90% of the women identified with cervical disease receive treatment. That means they're not getting treated right now. So this goal, if it's reached, will save 74 million women. That's amazing. Now think of the impact that would have on families. The World Health Organization strategy calls for the involvement of civil society partners and the meaningful engagement with and empowerment of affected populations. Soroptimists in Africa will play an important role over the coming years as the voice of women on the life-threatening health concerns, on this life-threatening health concern. But then how can we change these numbers? Amy's going to talk about that.
And I'm going to make this quick because I want to be able to answer any questions.
Yeah.
Here it is. First PAP screening should be at age 21 up to 65. My friend Laura put on Facebook, because this was on Facebook everywhere. She was going to forego her last PAP screening, but decided to do it because she saw my Facebook post, and she put on Facebook, "Thank you, Amy. I had my first abnormal PAP screening at the age of 64. I was turning 65 in May." So 65. Here it is. Educate yourselves about cervical cancer. educate your friends, your granddaughters, your daughters. Talk to them about, my daughter's 22. She's a little different because we talk about these things at my house, both my daughters. But a power of 100 women, this is no lie, I watched a woman go over on her telephone and call her granddaughter. It was that impactful. You have to talk about your bodies to them. So important. Talk about your club. Use the word vagina. And watch them go, ah.
She got me a vagina pin.
Yeah, no. But really, we're just trying to take the power out of the stigma of talking about Pap screenings, and it was helpful. Advocate for prevention, screening, and early detection. Have your family, regardless of how you feel about HPV vaccines, have your daughters and your granddaughters talk, probably your daughters, talk, or your granddaughters who might be having kids, talk to their pediatrician about how they feel about HPV vaccines. Please visit this African Federation website and consider a donation to their campaign. I'm not going to give you their address because it is on our presentation, which is going to be on the SNR website. It actually is. That website is on there, so please consider a donation. They need all the funds they can get. And to watch a really cool video, go to groundsforhealth.org. There's a really powerful, beautiful video that they have on there. So, anybody have any questions? Yeah.
I'm wondering where they came up with the numbers in Africa so late. So growing up in Germany, we talk about vaginas.
Yeah.
I have a gynecologist as a father. Trust me, we talked about vaginas and Pap smears. But we are a little bit more of an open-minded country. So all this in America was so weird to me, how you guys all don't talk about it. But how does Africa come up with such late ages?
Because they had to get attainable goals.
But they're skipping out on so many younger.
Well, it's fine. I'm sure they're trying to get them
And they'll probably move
earlier.
forward.
They're
Yes.
Okay.
But
Also,
they have to,
go ahead, Nikki. I'm
they
sorry.
have to set the goals as something that's attainable.
Okay.
And it was not realistic for them to say 9 years old at this point in time. But you have to move the bar a bit at a
Bit
time.
higher. Okay. Because
Also-
I've seen patients in my office in their 20s
Yeah.
with cervical cancer.
Yep. Yeah. So here it is as well. Africa still dealing with AIDS. I mean, it has wiped them out. So I would imagine that might be another reason they're a little behind.
That might be.
Yeah.
That makes
Yes.
You know, we
That
were
makes sense.
discussing this on our way out, and we were just talking about how women are stopped by their spouses, or, like, you can't go to the doctor. and do
Yeah,
that.
among Hispanic communities in
So
our
that's
area.
part of the reason.
Yes.
Yes.
too.
And that's very strong in Africa
Uneducated,
as well.
Yeah.
You would not believe how many, yes, Africa, definitely.
Yeah.
You would not believe, when we went to the clinics, almost every Hispanic woman that came had her husband or partner with her. She did not come by herself.
Yeah.
And a gaggle of children.
Yes,
Yeah.
and
And
Hmong
very embarrassed.
was
We
a
had
really
20
tough nut for us to crack, the
Oh.
Hmong
Yeah.
community, because they really do.
Which is sad, because they don't realize, it's very important for them to have that.
Well, and it's important for their daughters,
Yeah.
you know?
Next generation.
Yeah.
I'm hoping this year that we really are able to connect with the Hmong community. We have a community center in Orville.
Oh, yeah.
And I'm hoping to connect more with them this year, earlier, and make a personal connection with someone that we can talk to.
The goal is, you know how we always say, oh, look, it's, Breast Cancer Awareness Month, and everybody's got all these cute clothes and shirts, and, the NFL wears stuff, but most people don't know that January is cervical awareness. So we know we're gonna get airtime, we're hopefully gonna get some, and we also just ordered, paid for a huge banner that goes across downtown Chico that says January is Cervical Cancer Awareness Month. So, yeah, Go ahead, Rhonda.
All I was gonna say is, we were also talking about, and this, at least made you become more optimistic about the idea, is that 30 years ago, I started on a Pink October committee, and most every person we spoke to had never had a breast cancer, exam, literally. And if in a shorter period of time, we could make more people aware of this.
Yeah.
Yes.
Because you're right, it is a big thing and stuff, but it didn't used to be.
Yeah.
You know what I mean? It's
Right.
like, and hopefully we can make
I
this
think
happen.
I think it always has, but there's so many different reasons we don't talk about it. Because it's embarrassing. I don't want to talk about a pap smear. I don't want to think about my daughter having sex.
Yeah.
Guess what? She is.
Right.
Yeah.
Like, I don't want to think about my grandson having sex with somebody.
Yeah.
But by the way, 4 in 10 people that have HPV are men. Okay, 4 in 10. We didn't want to even go there with this because it's too much. What were you going to ask?
Just wanted clarification. So cervical cancer screenings are free.
Correct.
The money you're raising is for just education.
No,
And the
or
clinics, awareness, the
Giving.
clinics. Go
Yeah.
ahead.
Marketing,
Marketing.
like this year we're paying for that banner.
And a $25 gift card incentive.
And a candle, and this year we had some snacks and stuff. Now we know what not to do.
Okay.
What's important to the women are these gift cards, so we might up that.
Yeah.
And getting, I think it was 16, we're like 16, we handed out these pamphlets in the club, there's 60 of us, and everybody really, I'll take it here and I'll take it here, and 16 people, I think, or 12, came from Salvation Army. They were living there, and the person, whoever dropped them off there, the leader of Salvation Army brought them to get their screenings.
Yeah.